Today, we're going to explore an important global health issue that affects millions of people: diabetes. Whether it's type 1, type 2, or gestational diabetes, the core issue lies in impaired blood sugar control. Diabetes is a chronic metabolic disease. It occurs when the pancreas doesn't produce enough insulin or the body doesn't respond properly to it. Over time, high blood sugar can damage blood vessels, eyes, kidneys, and nerves. There are three main types of diabetes. Type 1 diabetes usually appears in younger people and is an autoimmune condition. Patients must rely on insulin injections to control blood sugar. Type 2 diabetes is the most common form. It's closely linked to poor diet, lack of exercise, obesity, and genetics. Though common in older adults, it's increasingly seen in younger populations. Gestational diabetes occurs during pregnancy, while blood sugar often returns to normal after birth. Affected women are more likely to develop type 2 diabetes later and should be monitored. So how can diet help manage blood sugar? The first step is to reduce free sugar intake. Free sugars include those added to food and drinks, as well as sugars in fruit juice and honey. Excessive intake is linked to obesity and chronic disease. Sugary beverages and highly processed foods should be avoided. Though this advice doesn't target people with diabetes, it's still best to consult a healthcare provider before regular use. Instead, focus on natural, unprocessed foods like vegetables, fruits, and whole grains, with moderate protein and healthy fats. This can slow carb absorption and help stabilize blood sugar. Some people adopt low-carb diets to manage blood glucose. While they may help in the short term, long-term use depends on individual health and should be supervised by professionals. For gestational diabetes, studies suggest low glycemic index, GI foods, may be better for both mother and baby. Choosing nutrient-dense, low GI foods is often recommended. Beyond diet, managing diabetes also involves regular exercise, quitting smoking, stress reduction, and routine blood sugar checks. For those with prediabetes or a family history, annual screenings are important to catch issues early. Most importantly, diabetes isn't a one-size-fits-all condition. Personalized care is essential. By working with doctors and dietitians to build a tailored plan, patients can better control their blood sugar and protect their long-term health.